Good afternoon. My name is Sky Hensley, and today I'm going to be speaking about Clostridium difficile, or C. diff as it's commonly referred to in the medical world. I will address what C. diff is, how a person acquires C. diff, what the signs and symptoms are, and also the treatments for curing the infection. First, we'll discuss what is C. diff. Well, C. diff is a highly contagious gram-positive spore-forming bacteria that causes severe diarrhea and colitis. Colitis is an inflammation of the gut and the digestive system, or colon. It can be life-threatening due to the fact that it can cut blood flow off to that area of the body. According to CDC.gov, more than 500,000 people are infected with this infections bacteria every year. Of those people that are infected, the ones that are 65 years of age or older that get infected with it, 1 in 11 of those people actually succumb to this infection and die. So next off, how do you get C. diff? Well, C. diff is what we call a hospital-acquired infection. What this means is that most people that acquire this infection are hospitalized, or they are patients at a long-term care facility. They've most commonly went through long-term antibiotic therapy, and that has caused the good flora in the gut to die off, and it allows bad bacteria to invade. So how is it spread? C. diff is spread fecal to oral route. What this means is that someone that has the infection does not use proper hygiene practices after using the restroom. So they don't wash their hands well, or they don't wash them at all. And then they go and they touch different objects. So they've transplanted this bacteria onto all these objects that they've touched. And another person comes along and then touches those same objects and gets it on their hands. They may not wash their hands before eating, or they may touch their face, and then they introduce the bacteria through the oral cavity that way. There are several risk factors for this infection. The most common risk factors are long-term antibiotic therapy, as I mentioned earlier, and hospitalization. 2 other risk factors are having an immune-compromised system, and also advanced age. Those are the 4 most common factors in developing this infection. The only way to prevent this infection is to have good hygiene. So these people need to be washing their hands thoroughly. Hand sanitizers and alcohols do not work to kill this bacteria because of its spore-forming nature. So hand washing really is the key to prevention. What are the signs and symptoms of this infection? Well, per Evolve's Medical Surgical Nursing by Lewis, Butcher, Heitkemper, and Harding, the signs and symptoms of a C. diff infection include fever, nausea, vomiting, watery diarrhea, and anorexia and abdominal pain. So ironically, the treatments for this are very similar to the causative. So, C. diff is caused by long-term use of antibiotic therapy, and it is also treated and cured by antibiotic therapy. The 2 most commonly used antibiotics for this are vancomycin and difficid. Sometimes those are not available, and when that is the circumstance, then they will use metronidazole long-term to treat this infection. Rarely, they may need to do surgery to remove infected portions of the colon in conjunction with antibiotic therapy as a curative form of treatment. So, in conclusion, I hope that you are able to gain an understanding of what C. diff is, how you acquire it, what the signs and symptoms are, and what the treatments are for this infection. So thank you and have a nice day.